Welcome back to Healthwise, and with me is my special guest, Dr. Baman Daneshvar. He's a radiation oncologist. Doc, we were talking about, I think you were getting into about the rectal cancer and about the test and stuff like that.
Yes, sir. We treat many different kinds of cancers. The most common ones are prostate, lung, breast, rectal, lymphomas. I mean, there's almost none you can mention that we don't have some hand in. The same with medical oncologists who do chemo. They virtually treat a little bit of everything. And you have to be a jack of all trades. You can, of course, specialize more in one or the other, but all radiation oncologists are fully trained to deal with all of those things. Same with surgical oncologists. But sometimes some of us do a little bit more than others. For example, in my field, I tended to treat half of my patients were prostate cancer patients. And one of the reasons was I introduced years ago something called prostate brachytherapy, where you put little seeds that are radioactive. So sometimes we were talking a little earlier about machines. Well, these are no machines at all. You actually put radioactive substances, little tiny metal pieces, into the tissue. And prostate is one of the main ones that's done significantly throughout the country because we have ability to get it right behind the skin into the prostate. And the patients don't even come for daily, weekly treatments.
Wow. So that's done. That's a surgical procedure.
It's a surgical procedure. So as patients find out what kind of cancer they have, it's important, even when they just first see a medical. And most of the time they assume, well, I got to see an oncologist. They don't think of the different types. They go see the medical, and the medical oncologist is very good in many ways, and they know of all these techniques, and then they'll get them to us when they know, oh, we have to send this person to a radiation oncologist, and we'll talk to them about prostate cancer or breast cancer. So we all know each other's roles as well.
Okay. So the referral may even come from could come even from your general practitioner, you know.
It can come from almost any specialties. Patients also assume they have to be referred. That's not true. We have the Opelousas Community Cancer Center. Our number is on the screen. People call there and just ask for advice. Oftentimes, I know patients are scared of their cancers, and when they call, we have nurses who've been in cancer care for almost 20 years. We have therapists who know about cancer care. We'll talk to them for free. I've always offered my staff to say, if someone calls here and wants to know about prostate cancer or breast cancer or something, offer them a free consultation. It's no skin off my teeth. I'm there. Right. I will visit with them. And if they're anxious, they want to just talk on the phone, we talk on the phone. That doesn't always happen, I understand, in other specialties. But I think in our area, both our nurses, staff, and other physicians learn you have to be more caring in a cancer patient. It just takes that to be able to take care of these people.
Right. And we were talking earlier too also about knowing that your doctor or your oncologist or your specialist is certified, board certified, not just licensed, but certified.
I think that's important. In radiation oncology specifically, you have to know, you of course go to medical school and you become a doctor, so you know how to do the general medical care on somebody. But we get very high intensive training in physics and what we call radiobiology. So we're doing things and learning things that are so complex, and these machines are so complex. We have to learn how to read films, we have to learn how to operate computers. Not every person is amenable to that. So they test us after we finish our training. So someone finishes his radiation oncology, goes out, and he can get a medical license to practice medicine. So that's licensure. However, nobody that gets out, including myself, automatically is certified. So you can practice because you learn quite a bit in that 3-4 years, but if you throw that person out into the world, he's still learning. So in about a year or two process, he hopefully learns the rest of what he needs to know to go up to usually Louisville, Kentucky is where they hold our national board exams. So the American Board of Radiology tests us first initially with written tests, and then once we pass those, then with oral tests. Many specialties have this, so it's not just for radiation oncology, but I'm explaining it for of ours. then you become board certified. So it gives a patient another level of confidence that my physician is not just licensed to practice, because you're allowed to practice that all you want, and there's no limitation to seeing cancer patients or getting referrals. But if you're certified, you pass rigorous tests that shows you know what you're doing.
Right.
It's more, you're more sure to get a better outcome, in my opinion. Not necessarily, but in general.
Right, right. And so you would want to try to get a specialist that's certified, and not just in, like you said, radiation oncology, in everything. If you want the best, I guess the best bang for your buck is what you know?
I would think it gives you a better, just like people are searching MD Anderson. They search them because they're specializing in cancer.
Right.
But a radiation oncologist, of course, is treating cancer, but if he's certified, then he's passed rigorous tests. You should ask your surgeon or your oncologist, are you sending me to a certified person? Even if you don't want to ask, there's websites, which I don't have the name of it, but if you Google it, board certification, they're free. A person can sign up to this website, American Board of Medical Specialties, and enter any doctor's name in any state, and they'll pop up if they have that certification. Now again, let's say you're not certified. Like the first 2 years, I would hope people weren't doing that to me. I'd never see anybody. But in that situation, the first couple of years, I aligned myself with other doctors who were, and I was in a group. So as I learned, it was a continual learning process.
Sure.
So the first couple of years of my practice, I was associated with Dr. Jim Easley, and he stayed, and he had 25 years experience. He was a chairman of Methodist in Houston. Everyone knows Methodist there.
Right.
So I was very fortunate. I kind of learned from some of the best. And then when I got certified and he was comfortable that I knew what I was doing,
and
he retired, actually.
Okay, I got you. Okay, Doc, we're going to come back. We got a few minutes left, and we're going to talk a few minutes more about your specialty, and we'll be back after this message from our sponsors.